Anemia. What is anemia? According to Huther, anemia is a reduction in the total number of erythrocytes in the circulating blood or a decrease in the quality or quantity of hemoglobin. And we know erythrocytes are red blood cells. There are 4 different complications that can occur in the human body that could result in anemia. The first one is impaired erythrocyte production. 2. Acute or chronic blood loss. 3. Increased erythrocyte destruction. Or 4, which is a combination of all 3 of those factors. Signs and symptoms of anemia are fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, or headaches. There are many different types of anemia. There is iron deficiency anemia, which is the most common, and it is caused by the lack of the proper amount of iron in the body. Vitamin deficiency anemia is caused by the lack of folate and vitamin B12, which are used by the body to produce healthy red blood cells. When the body is lacking these vitamins, it can cause a decreased red blood cell production. There's anemia of inflammation, which is caused by certain diseases like cancer, HIV or AIDS, rheumatoid arthritis, or kidney disease, because these diseases can prevent the proper production of red blood cells. Aplastic anemia is a rare but life-threatening anemia. It happens when the body does not produce the proper amount of red blood cells. There's anemias associated with bone marrow diseases. It's associated with leukemia and myofibrosis by affecting blood production in the bone marrow. Hemolytic anemias develop when red blood cells are being destroyed faster than bone marrow can replace them. Hemolytic anemia can be inherited or developed later on in life. And then there's sickle cell anemia. It's an inherited condition and can sometimes be very serious. It is caused by a faulty form of hemoglobin that makes red blood cells assume an abnormal crescent shape. These messed up blood cells die prematurely, which leads to a chronic shortage of red blood cells. So, how can we prevent anemia? Most types of anemia, unfortunately, cannot be prevented. However, iron deficiency anemia and vitamin deficiency anemia can be prevented with a proper diet. To prevent these 2 anemias from occurring, an individual would need to eat foods rich in iron, folate, vitamin B12, and vitamin C. Supplements can also be taken to ensure that you are getting the proper amount of nutrition to prevent getting vitamin deficiency anemia or iron deficiency anemia.